I'm Kayla Danzig. I am a graduate student and I'm an emergency medical technician. And I was 22 when I had my first fusion and 23 when I had my second fusion. So I first noticed my chronic back pain. I was home from college and I was sitting on the floor in my bedroom and I tried to get up, but I was in so much pain that I couldn't. And I had to have my brother come into my bedroom and physically lift me off of the floor so I could get up. I have always been super active. I was a dancer in middle school, cheerleader in high school, dabbled in parkour and weightlifting, going to the gym doing cardio. And so when I started having the SI joint dysfunction, I had to stop doing these things that were an integral part of my life. After I graduated college, I got a job flying Lear jets for an air ambulance company, and I had to go to Texas for a few weeks for training. And while I was out there, the training consisted of sitting in a classroom all day and going into flight simulators. And I was just having a very difficult time sitting in the desk all day. And then when I got back from that trip to Texas is really when I sought out Dr. Bui.
Hello, my name is Tuan Bui. I'm an orthopedic spine surgeon here in Atlanta, Georgia, and I practice at Ortho Atlanta. We're here today to talk about back pain and common causes of back pain, and one of those causes is the SI joint itself, which is the sacroiliac joint. The joint between the sacrum and the pelvis is called the SI joint. It connects your upper extremities and your torso to the lower parts of your spine and your legs. That joint is connected by ligaments, and the joint itself is a joint, so there's motion there. A lot of people who come in for low back pain don't realize that it could be coming from their SI joint. Statistics and studies have proven that at least 15 to 30% of patients with chronic low back pain, the symptoms could actually be stemming from the sacroiliac joint itself. A lot of people who've had lumbar spine surgeries, but they still are symptomatic after the surgery, then 40% of those patients could be coming from the SI joint. The most important thing, and if you talk to any physician itself, and this is what's taught in medical school, is to get the history and talk to the patient. So when you come to me, I'm going to ask you all these different questions. They're going to ask you about your pain, your description of your pain, where it's coming from, and what's limiting your activities. And from that, I'm going to put a differential diagnosis together. Typically though, to be honest with you, the best differential, the best diagnosis is not only physical exam and medical history and your history, you telling me your symptoms, but also a diagnostic injection into the joint of the SI joint itself and seeing if you get some relief. And it may be temporarily, it might be just short-term relief, but if you're giving some relief, that's a positive predictive value that that's where your symptoms are coming from. Then the treatment options are typically physical therapy, conservative stuff, pain medications, even just over-the-counter medications. If we need to, we can go to stronger ones. Some physical therapy to strengthen the muscles and the ligaments itself, stabilize that joint a little bit, and then also possibly some belts. So there are some belts out there to do SI joint stabilization belts that could help. Then there's medications, not only just orally, but topical that we can try. There's a myriad list of things that we can do. And I'd always like to do all these things, exhaust all measures before I consider a surgery. A surgical option would be to consider fusing the joint. If we stabilize it, then it doesn't hurt anymore. And a way to stabilize it is what's called an SI joint fusion, a sacroiliac fusion. The joint is a rotational motion joint. So if we put these little implants across the joint, then it stabilizes the joint itself and it doesn't cause pain anymore.
My right side was worse than my left side was, so we figured we'd get the one that was worse done first. So I went probably about a year having my right side only fused, and I was still having pain with my left side, and it went so well with my right side that I was like, you know what, I might as well just get the surgery and then I don't have to think about it anymore. And I'm very glad that I did so. Post-operatively, I'm pretty much able to do everything that I was before I started having my SI joint pain. I can go to the gym, lift weights, do cardio, do all of the activities that I want to do.
So I started doing these surgeries several years ago, and patients have done very well with it, at least in my practice and in my experience. Most patients who we really identified that the SI joint is the problem and again, failing all conservative treatment. If we proceed with the surgery, they're very happy with it. Long-lasting relief. If you're still considering if the SI joint is your pain generator, I invite you to come in to discuss that further.